All right, let's jump right into a situation you've probably seen 100 times. You're on scene, you've got a patient who is just completely miserable. They're telling you they're sick from both ends, you know the call. But having one really sharp, high-yield rule in your back pocket, that can make all the difference. So let's kick things off with a pretty direct question. When you see this specific combo, I mean both vomiting and diarrhea happening together, what's the very first thing that should pop into your head? Because that pattern, it's a huge clinical clue. And here it is. This is the golden rule, the simple equation you need to burn into your brain. If you've got vomiting plus diarrhea, you are thinking gastroenteritis until you find a really, really good reason not to. It's a simple, effective, and, most importantly, a safe place to start your assessment. So what the heck is gastroenteritis anyway? Well, at its core, it's just an angry, inflamed gut. The usual suspect is a virus, like norovirus. But keep in mind, it could also be bacteria, some kind of toxin, or maybe just a bad run-in with some sketchy leftovers. Okay, so we've got our working diagnosis. But what does that vomiting plus diarrhea pattern really tell us on scene? Let's dig into the full clinical picture that you should probably expect to see. All these symptoms, they tell a very consistent story. The vomiting and diarrhea are the headliners for sure, but they almost always bring their friends along. Cramping, nausea, just being wiped out and exhausted. You might even see a little bit of a low-grade fever. All of it just screams irritation somewhere in the GI tract. Now, for the patient, here's the good news. This thing is usually a pretty short fight. For most simple cases, there's self-limiting. People start feeling better within a day or two. But for us, in the field, our biggest worry isn't the bug itself. It's the number one complication it causes. And this right here is the absolute key. For any first responder, your primary overriding concern with gastroenteritis is dehydration. Think about it. The body is losing fluids from two directions at once. And that massive fluid loss, that's what can take a patient from feeling awful to being critically ill. This is the problem we have to solve. Right. So if dehydration is the big bad, what do we do about it? Let's shift gears and talk about your action plan. A clear, simple set of priorities for when you're on scene. Your game plan really breaks down into 4 simple, crucial steps. First things first, assess their hydration status. Check their skin turgor, look at their heart rate, ask if they're dizzy. Step 2, if they're dry, you gotta start replacing those fluids. Step 3, get that nausea under control, because if they can't stop throwing up, they're never gonna rehydrate. And finally, your safety check. Rule out the really bad stuff. And this is where it all just clicks, right? This is that classic presentation. Your patient feels lightheaded, their heart is racing, but their temp is normal. You add in the vomiting and the diarrhea and boom, every single sign is pointing straight at viral gastroenteritis causing dehydration. The pattern is just unmistakable. Now, let's talk about that crucial final step. Remember our rule? Gastroenteritis until proven otherwise. That last part is everything. That's your safety net. You have to actively hunt for reasons why this might not be a simple stomach bug. And these are the big ones. These are the showstoppers you have to consider. Is there any sign of a GI bleed? Is that abdominal pain absolutely severe? Or is their belly rigid like a board? Could they have ingested something toxic? And of course, in a female patient of childbearing age, could this be pregnancy-related? Asking these questions, that's what makes for a truly solid assessment. So we'll leave you with this thought. You've followed the rule, you see the full clinical picture, and you've cleared all the major red flags. You know your patient has gastroenteritis, and you know they're dehydrated. So what's your next move? Right now, what's the very first thing you're going to do to get ahead of that fluid loss? Because that is the key to providing great care on these super common calls.